Hospital administrators are reportedly inconsolable following reports that personnel at the London clinic attempted to access Princess Kate's personal health records. Following allegations that Princess Kate's patient confidentiality was violated during her scheduled abdominal surgery in January, the London clinic has expeditiously opened an investigation. Hospital administrators are reportedly inconsolable following an apparent attempt by co-workers to view the Princess of Wales's personal health records. According to the Mirror, during the mother of three's nearly 2-week stay as a patient earlier this year, at least one staff member was allegedly discovered attempting to obtain her notes. The Marylebone Hospital in central London is well known for quietly treating celebrities, high-ranking politicians, and royals, including King Charles. The hospital reportedly notified Kensington Palace of the security breach earlier, and it is thought that the Princess of Wales was made aware of the purported occurrence. This is a major security breach and extremely damaging for the hospital, given its untarnished reputation for treating members of the royal family, a source told the Mirror. As soon as the matter was brought to their attention, senior hospital administrators contacted Kensington Palace and promised a thorough inquiry. The whole medical staff have been left utterly shocked and distraught over the allegations, and were very hurt that a trusted colleague could have allegedly been responsible for such a breach of trust and ethics. Regarding the recent allegations, a representative for Kensington Palace stated, "This is a matter for the London clinic." Not only did the hospital not respond to the publication, but it also stated that we firmly believe that all of our patients, no matter their status, deserve total privacy and confidentiality regarding their medical information. The article states that the Metropolitan Police has not acknowledged if it was aware of the accusations. According to Kensington Palace, Princess Kate was hospitalized to the London clinic on January 16 for a planned and successful stomach surgery. The future Queen's health has not been made public, other than the palace's intermittent updates stating that she is recovering well. It is anticipated that the monarch will not return to her royal duties until after Easter. We have reached out to the London clinic, the Metropolitan Police, and Kensington Palace for comments. In the heart of London, the air was crisp and cool as winter began to settle in. Kensington Palace, home to the Duke and Duchess of Cambridge, stood as a beacon of tradition and history amidst the bustling city. Inside its hallowed halls, however, a storm was brewing, a storm of concern and fear that threatened to disrupt the royal family's peace. It all began when Princess Kate, the beloved Duchess of Cambridge, fell ill. After a series of persistent symptoms, she decided to seek medical attention at a renowned London hospital. The hospital, known for its discretion and top-tier medical care, was trusted by the royal family to provide the utmost privacy and security. However, this trust was about to be shaken. One afternoon, as the Duchess rested after a series of tests, a senior hospital administrator received a call that would send shockwaves through the institution. It was a routine security audit that uncovered an unsettling discovery. Several hospital staff members had attempted to access Princess Kate's medical records without authorization. The news quickly reached the hospital's upper echelons, prompting an immediate and thorough investigation. The hospital's CEO, Dr. Elizabeth Hartley, convened an emergency meeting with the heads of security and IT, demanding answers and swift action. "This is unacceptable," Dr. Hartley said, her voice a mix of anger and concern. "We must ensure that this never happens again. Our patients, especially those of the Duchess's stature, trust us to protect their privacy. We cannot fail them." The hospital's IT department began combing through access logs, identifying the individuals who had attempted to breach the Duchess's records. It was a meticulous process, but within hours it had a list of suspects. These individuals were immediately suspended pending further investigation, and Dr. Hartley made a personal call to Kensington Palace to inform them of the breach. At Kensington Palace, the atmosphere was tense as Prince William received the call from Dr. Hartley. His face grew stern as he listened, his protective instincts for his wife and family kicking into high gear. After thanking Dr. Hartley for her transparency and swift action, he hung up the phone and turned to his private secretary. "Get me the head of our security team," he said firmly. "We need to address this immediately." Within minutes, the palace's head of security, Sir James McAllister, arrived. A former high-ranking officer in the British Army, Sir James was known for his unflappable demeanor and strategic mind. He listened intently as Prince William relayed the details of the breach. "We cannot take any chances with Kate's safety and privacy," Prince William said, his voice resolute. "We need to ensure this doesn't happen again." Sir James nodded. "I understand, Your Royal Highness. We'll conduct a full review of the hospital's security protocols and our own. I'll also liaise with Dr. Hartley to ensure that those responsible are held accountable." In the days that followed, security around Princess Kate was significantly heightened. Sir James coordinated with the hospital to implement additional safeguards, including restricting access to Kate's medical records to a select few and increasing physical security measures around her treatment area. At the same time, an internal review was conducted at Kensington Palace to identify any potential vulnerabilities. The palace's IT team implemented advanced encryption measures to protect sensitive information, and staff members were reminded of their responsibilities regarding confidentiality. Princess Kate, though shaken by the breach, remained composed. Her priority was her health and her family, and she trusted Prince William and Sir James to handle the security concerns. She continued her treatments with the support of her loved ones, determined not to let the breach disrupt her recovery. Back at the hospital, the investigation into the unauthorized access was making progress. The IT team had identified 5 staff members who had attempted to view Princess Kate's records. Each of these individuals was brought in for questioning. The reasons for their actions varied. Some claimed curiosity, others suggested they were trying to verify rumors that had been circulating. Regardless of their motivations, the breach of privacy was inexcusable. Dr. Hartley, with a heavy heart, made the decision to terminate the contracts of those involved and reported their actions to the appropriate regulatory bodies. To prevent future incidents, the hospital implemented new training programs focused on patient confidentiality and the severe consequences of breaching it. Security systems were also upgraded to provide real-time alerts for any unauthorized access attempts. Despite the hospital's and palace's efforts to keep the breach under wraps, news of the incident eventually leaked to the media. Headlines screamed about the security breach, and the public's concern for Princess Kate's privacy grew. The media frenzy added another layer of stress to an already tense situation. Prince William, aware of the need to address the public's concerns, decided to make a statement. In a carefully prepared speech, he expressed gratitude for the support the family had received and assured the public that steps were being taken to protect Kate's privacy and security. "We are deeply grateful for the concern and support shown by so many during this challenging time," he said. "Please rest assured that we are taking all necessary measures to ensure the safety and privacy of our family." The public reaction to the breach was mixed. Many expressed outrage on behalf of the Duchess, condemning the actions of the hospital staff and calling for stricter penalties for privacy violations. Social media was flooded with messages of support for Kate and her family, with hashtags like #ProtectKate and #PrivacyMatters trending. However, there was also a small but vocal minority who criticized the royal family for what they perceived as excessive secrecy and privilege. These individuals argued that the public had a right to know about the health of a prominent public figure. The debate highlighted the delicate balance between privacy and transparency for the royal family. The breach had shaken the trust between the royal family and the hospital, but both parties were committed to rebuilding it. Dr. Hartley and Sir James worked closely together to ensure that the new security measures were effective and that communication remained open and transparent. Princess Kate, once her health had improved, made a point to visit the hospital to thank the staff who had cared for her. Her visit was a gesture of goodwill and a testament to her resilience. It was a private affair, away from the media's prying eyes, but it went a long way in mending relationships. Throughout the ordeal, the strength of the royal family was evident. Prince William and Princess Kate leaned on each other for support, their bond only growing stronger in the face of adversity. Their children, though shielded from the full extent of the situation, sensed the gravity of what their parents were going through and responded with maturity beyond their years. George, Charlotte, and Louis provided a sense of normalcy and joy, their laughter and innocence a comforting presence during the challenging times. The family spent more time together, cherishing each moment and finding solace in their unity. As the months passed, the immediate crisis began to subside. The hospital had implemented stringent new protocols, and the palace had reinforced its own security measures. The public, reassured by Prince William's statement and Princess Kate's recovery, gradually shifted their attention to other matters. Princess Kate's health continued to improve, and she gradually resumed her public duties. Her first appearance after the breach was met with an outpouring of support. She addressed the public with grace and gratitude, acknowledging the challenges she had faced and the importance of privacy and security. "I am deeply touched by the support and concern shown by so many," she said. "It has been a challenging time, but with the love of my family and the dedication of the medical professionals who have cared for me, I am moving forward with hope and strength." The experience had a lasting impact on Princess Kate and Prince William. They became strong advocates for patient privacy, using their platform to raise awareness about the importance of confidentiality in healthcare. They supported initiatives aimed at strengthening data protection laws and improving security measures in hospitals. Their advocacy work included visiting hospitals and speaking with healthcare professionals about the challenges they faced in maintaining patient privacy. They also met with policymakers to discuss potential reforms and improvements to existing regulations. The breach had far-reaching implications beyond the royal family. It sparked a national conversation about privacy and security in the digital age. Hospitals and healthcare providers across the country reviewed and updated their own security protocols, recognizing the need to protect patient information more rigorously. The incident also prompted a review of existing laws and regulations governing data protection. Policymakers considered new measures to ensure that breaches like the one involving Princess Kate would be less likely to occur in the future. The royal family's experience served as a catalyst for positive change, highlighting the importance of privacy in an increasingly connected world. For Princess Kate, the ordeal was a time of personal reflection and growth. She had faced a significant health challenge and had her privacy invaded in a deeply unsettling way. Yet she emerged from the experience stronger and more determined to use her platform for good. She spent more time focusing on her health and well-being, prioritizing self-care and mindfulness. She also made it a point to spend quality time with her family, cherishing the moments of togetherness that brought joy and comfort. The royal family's resilience in the face of adversity was a source of inspiration to many. They had navigated a difficult journey,